Hey folks, Nick the nurse here. On NCLEX exams or on your nursing school examinations, oftentimes you're going to be tested on nursing procedures. It's good to focus on nursing diseases and lab tests and the like, but one of the really big testable areas are diagnostic procedures and tests. So one thing that I'd like to talk about today are treadmill stress tests. Now, treadmill stress tests are often utilized they're ordered by physicians or medical providers to provide further insight when a patient complains of chest pain. We don't really need to worry about all that. That's really the physician's purview. What we need to know about is what happens during a stress treadmill test and what is expected for the licensed nurse to do during that particular exam. So what happens is the patient is going to arrive. They're generally going to have comfortable shoes on, and what's going to happen is that they're going to be asked to walk on a treadmill. And they're going to have all of these electrodes all over their chest, and they're going to have a blood pressure cuff on their arm. And the nurse will go ahead and monitor the patient throughout the duration of the test. And what the treadmill is supposed to do is see how fast you can walk on the treadmill before you start experiencing any type of pain or any type of discomfort, or your blood pressure goes up too fast, or your heart rate goes up too fast, or what have you. Based on the what do you call it, how fast it's going. I already said that, sorry. And also what happens is it goes on an incline. So the nurse who's running the particular test is going to put the exam on an incline. So they're trying to see how your heart basically reacts to stress. So that's a really important thing for them to know, so they can take that information back to the physician and look at it. So some of the things that you might see on a stress treadmill test is the patient is walking faster, and they might even progress to a slow jog, or maybe even running if they're really a fit younger person. You might see their heart rate increase. You might see their blood pressure increase. You might see their respiratory rate increase. Now, these are all normal things that happen when somebody exerts themselves through physical activity. What you would not really expect to see is an increasing chest pain with the patient. The patient shouldn't have active chest pain during the procedure. If a patient does exhibit or complain of chest pain during the procedure, the physician should be notified immediately. Now, I've seen where they sometimes have a nurse who's doing the treadmill test by themselves, alone in a room with the patient. They should notify the doctor. Other times I've actually seen the physicians in the room with the nurse and the patient helping with the exam. So you might see it come up under two different scenarios, but make sure that you understand what a treadmill stress test is, what it's used for, and some of the things that you might see with the patient. But if the patient does exhibit chest pain, immediately notify the physician. Again, my name is Nick the nurse. I'd like to thank you for watching this video today. If you'd like to check out any of my other completely free videos, they're all online at www.nickthenurse.com. Again, that's www.nickthenurse.com, or feel free to subscribe to my YouTube channel, Nick the Nurse. Thank you for watching. I'll see you next time.